Mum had a bit of a fall from her chair. She has dementia and she's disabled. I picked her up off the floor and it looked as though she'd had a stroke. I called the ambulance and they decided that she needed the hospital.
The Liaison Hub is a team of multi-professionals who are working together, based at the hospital, but the most of their work is actually carried out in the care home beds across the county.
Staying in hospital for the full extent of one's recovery is neither necessary nor desirable. Reducing exposure to other people who are unwell, reducing exposure to infections by moving into a hub facility increases the probability that someone's transition into wellness is going to continue without being broken up by the harms of being in a hospital environment. There's a huge psychological component to being cared for. Within 3 days, many particularly older or more vulnerable people will become incontinent, whereas previously they weren't, just by virtue of having the availability of someone to look after your most basic needs. So by expediting a transition from being in a cared for hospital environment to a much more natural, homely environment, still within the support of a nursing home or care home, then we can make sure that we're avoiding that increased dependence which a lot of patients experience. We no longer see care as being a black or white division between pure hospital care until you're fully better and then discharged home. We don't like the idea of discharge.
Radcliffe told me we managed to find you a bed in the nursing home that your wife's in. And I said, well, just thought it'd be good companionship for you, nice and to be together. And I very much enjoyed it there, I really did.
I've seen really great results from people being enabled to get out of hospital, continue to have their rehabilitation and care, but in a setting that is much more homely. The Liaison Hub is a key component for ensuring that the whole system is using its capacity efficiently. I'm absolutely certain it's helping patients. The patients that I've worked with have really thrived.
The Liaison Hub made such a difference to us because actually it got Mum to the place that she really needs to be. I can't thank them enough. I'm really pleased with the way things went.